In this video, we'll go through the elbow palpation. We will start with the humeral ulnar joint and then the radial ulnar joint. So starting with the humeral ulnar joint, our first palpation is a long axis distraction. So our patient will have a bend in their elbow here, they'll be palm up here. I'm going to grasp distally on the radius and ulna, and I'm going to block the humerus here. My fingers are going to wrap around to the other side so I can palpate that olecranon process. Then I'm going to brace with a web contact here and pull against my web contact, feeling for just that minimal amount of distraction that we can have with that olecranon process. Next is a lateral to medial palpation. So with the elbow extended, I'm going to lock the elbow and then just slightly unlock the elbow here and challenge lateral to medial. Again, locked and unlocked, medial to lateral. The last palpation for the humeral ulnar joint is a P to A. So we will palpate that olecranon process here. We'll use just the tips of our fingers as we contact that olecranon process. I like to bring that arm in front of the patient. I feel like that can maybe make it a little bit less stressful as we press P to A on that olecranon process. It should be nice and springy. The next two palpations are for the radial ulnar joint. So we have an A to P and a P to A here. The P to A will palpate that radial head. So that radial head, I'm going to use a thumb contact here, and I'm going to challenge straight P to A. For our A to P palpation, we have all the soft tissue in the way, so we can't simply just use a thumb and challenge. The easiest way to do this is to have your patient sit palm up. We'll use a tissue pull. So we'll use a tissue pull over here. You guys can see this soft tissue here. So we'll use that tissue pull here, and then my other hand is going to palpate over that radial head. So as I tissue pull over, I palpate over that radial head. My patient leans away from me slightly, and then I challenge A to P. And my goal is to pull with this hand and then palpate and feel with the opposite hand. You should be able to feel that radial head kind of move with it. So this was the palpation of the humeral ulnar joint and the radial ulnar joints.